Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer of Douglas County today. I'm joined today by Christin Rutledge, who's the Vice President for Community Health at Aviva, and we'll talk a little bit later about all of the great work that Aviva has been doing to support the COVID effort in the state and in the community. But as always, we're going to answer some questions from people who sent them in, and we'll give you an update on how things are going. We usually start at the world level, and at the world level, COVID has been pretty quiet over the last 3 weeks. All of the continents are having decreased number of cases, and actually there are many places that are having very low numbers of cases. So much of Western Europe, including Spain, Portugal, and France, are having very low levels of disease, and they've been able to get back to many of the activities that they previously enjoyed. We're still a little worried about some places in the world, especially the Philippines, which has both a low vaccine rate and a struggling healthcare system. We're still seeing a lot of disease in Malaysia and Indonesia, but other places in Asia that had troubles in the last few weeks, including Japan, who had some issues after the Olympics, are now starting to see an improvement. We still see more cases than we would like to see in Africa, because in Africa, they've had a very low vaccination rate. In the US, we started with a lot of cases in the upper Midwest, and then they've moved south and east, so that now Missouri and Arkansas, which started with cases, are now relatively low, but Tennessee, Kentucky, and West Virginia are really struggling. We're also seeing other states in the West struggle. So parts of northern Nevada, western Montana, Wyoming are really struggling. And in Oregon, eastern Oregon is having far more cases than is western Oregon. So Oregon overall is kind of at the state average. In Douglas County, we were way above the state and national average for a while. We've moved down. We're now averaging about 40 cases a day. Although we still have some days that we have a high number of cases, and other days it's lower. In terms of hospitalizations, we still have a lot of hospitalizations. Still over 60 Douglas County residents are hospitalized, and they're hospitalized all over. They're hospitalized at Mercy, but then they're also hospitalized at hospitals to the north and the south, and even as far away as Washington. And what we're seeing is that many of these people have been in the hospital for a very long time. So there are at least a dozen people who were admitted before September 1st who are still in the hospital now. And following those hospitalizations, unfortunately, we're continuing to see a high number of deaths. So we've had well over 120 deaths since the 1st of August. That's a lot of deaths. In Douglas County, we have about 112,000 people. We typically are adding, we have about 1,000 births and 1,000 deaths a year. And we're certainly going to have more than our share of deaths this year, mostly related to COVID. Vaccine is still available. It's still widely effective. When we look, about 75% effective in preventing symptomatic disease and over 90% effective in preventing hospitalizations and deaths. So although the vaccine is a little less effective than it previously was, still very, very effective and still widely available. And one of the reasons it's so widely available is from all the help that we've had at Aviva. And Aviva has really been a key partner in our vaccination efforts. They do so many things. So Christin, tell us about what you guys are doing now with vaccines.
So we are continuing to do vaccines. We're offering booster doses as well. I just pulled some numbers a little bit ago, it's great to see. So since the beginning of September, we've given 371 vaccines. Most of those have been first doses. So we are seeing more people that are coming in for their first doses than we anticipated. It kind of dropped off, as you saw too, in the beginning of July, and then August, September, it picked up again for first doses. Doing third doses for people that were immunocompromised, and then now we're seeing a lot more of those booster doses come in this week. We're requesting that people actually call and schedule for that. But it's busy every day still. So we thought we might see a drop off, but we haven't seen that yet.
So in addition to vaccination, you're also doing testing?
Yep, we're doing testing. We're doing drive-through testing at this point because we found that it's a lot easier than before. What we were doing is we were kind of going out to cars and trying to number the cars. It was too hard. We have a really great space where we have 2 lanes open. People can come through, they get registered, and then they go and they wait for their test results. We are now charging for leisure testing. So if somebody wants to go to a football game or their employer is requiring that they have a negative test to return to work, we are charging for that upon arrival. But for everybody else, if they have symptoms or have been a contact, we're continuing to do the free testing that we were doing before. And the numbers for that, this is quite a bit, especially through the surge, we saw an increase, but we did 676 tests in September alone so far. So that's quite a bit of people that are coming through that drive-through. They're really, really grateful that we're offering this because some of their providers aren't offering it anymore. And then they don't have to go to necessarily an urgent care if they don't need to be seen. So I'm just really excited that we can still offer this service, and we're going to continue to do this. We're really committed to offering these for as long as the community needs it.
Great. And then you guys also helped out clinically. So during the time that Mercy was so overwhelmed, tell us how Aviva helped out there.
Yes, we did the pre-ER treatment. So if people didn't get a chance to see that or to kind of read about it in the newspaper, a patient would come in, they'd be triaged first at the tent. And then if they were somebody who was positive for COVID or needed to be tested for COVID and necessarily didn't need to be hospitalized, they would go over to a modular so that they could get monoclonal antibodies, they could get oxygen if needed, they could get services that they needed right there on the spot, but not be hospitalized for the disease. And then that allowed the ER to be open for people that needed to come in, like with a heart attack or with like a car accident or something. It just allowed people to be routed in a way that we could keep people from being exposed as well.
Well, that is great. And then I saw a big van out there. Tell us about that.
So the mobile unit. Yeah, so that was the large mobile unit that the county commissioners have graciously bought for Aviva. We have a small unit and we have a large unit, and that was where one of the spaces where they were doing the examinations were. So we also had staff there. I believe we had a nurse on site at all times, and then we had 2 medical assistants. So they went straight from our clinic over to there. We were really committed to doing that. So with our clinical staff, it was, we all picked up after each other and made sure that we could make this happen because we saw how important it was to not overwhelm the hospital staff. And then we also had an acute care clinic because we saw the urgent cares were being really, really busy, long wait time. So for our patients, we had an acute care clinic that they could get in that day. So what we had actually a lot of times is people go through the COVID, the drive-through testing, they're positive for COVID. And even if they were negative, but still had symptoms they needed to be checked out, they could go straight into the clinic, see a provider in a really safe way. And that was something that we were able to see. I think we saw about 60 patients in the couple weeks we had it open.
Well, that's great. And then the other thing that Aviva is doing is helping to supply local clinics and pharmacies with vaccines. So in many places in the state, they only have a few people in the entire county who are giving vaccine. Yet in Douglas County, we have over 40 vaccine providers. And we've been able to do that because we've been able to smooth a lot of the things through. And it really is thanks to Aviva Health. So tell us how that works.
So we are the hub. So what happens is Dr. Bob goes ahead and orders all the vaccine that we need for the coming time, and it comes to Aviva. We hold it at Aviva until people tell us what they need so they can get a vial. So instead of ordering a couple hundred doses that they might have before needed to do, they can weekly order a vial. They can tell us if they need to. If they have an event coming up and are going to use more, they can send us a request. And then someone from DPHN comes and picks it up every week, delivers it. They deliver it to Douglas County, to the coast. We're happy that we can hold that. We also give the supplies that are needed for it. We have great staff that have managed to make this really, really smooth. And I think that anywhere in this county, you can get a vaccine. What I like is that you don't have to just come to Aviva to get a vaccine. You don't have to just go to a specific place to get one. You can kind of go anywhere. And it is because we have this kind of hub and spoke model going on.
And that's all thanks to Aviva. So I have a small part in this. It really is the hard workers over there that are doing it. And they have incredible technology to store this. So the Pfizer vaccine, for example, needs to be stored at incredibly low temperatures, and you need special freezers to do that. And Aviva has all of that and does such a beautiful job with that. So thank you for that. So Aviva has not necessarily tooted its own horn very much, but in this whole COVID effort, Aviva has truly been a key partner, and Christin, leading the community health effort, you're certainly part of that. So thank you again. I don't thank you enough.
Yeah, thank you.
And thanks everybody else for listening. We'll do this again next week. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, here today with Christin Rutledge, the Vice President for Community Health at Aviva Health. Thank you.